Good day, everybody. Welcome to our rationalization for your Nloa 1 prelim examination. And of course, we will be talking about 25 items of this prelim exam that is pertaining to the second set of your community health nursing. Let's begin. My first topic is about healthcare delivery system. So let's have our first situation. So, by the way, this healthcare delivery system is an application of what has been discussed in your FAMWORK book. Situation A: Nurse A is the public health nurse of Barangay Health Station of Barangay A. He is assigned to a small and economically disadvantaged neighborhood. His assigned community has high rates of chronic illness, and the people in that community complains of limited access to healthcare facilities. Nurse A is tasked with improving the healthcare outcome of the community through the implementation of various programs and community engagement activities. The following questions apply to this situation. Question number one: Nurse A notices the incidence rates and high prevalence of hypertension in the neighborhood when his barangay health workers submitted their monthly report to the barangay health station. What immediate action should Nurse A take to address the problem? The question here is immediate action. So this is in relationship to the patient having the high prevalence rate of hypertension. Letter A: Nurse A initiates regular blood pressure screening events at the barangay health station. Letter B: Nurse A starts a campaign that promotes gym memberships. Letter C: Nurse A conducts a survey on dietary habits in barangay. Or letter D: Nurse A partners with local restaurants to offer discounts on healthy meals. Remember, our focus this time is all about assessment, right? Because what has been asked is what immediate action should Nurse A take to address the problem. So we cannot actually make an action without following an assessment. So this is actually prioritization of tasks that pertains to nursing process. So this time we will eliminate immediately letter D. Nurse A partners with local restaurants to offer discounts on healthy meals. This is already a form of uh, intervention. But remember, the neighborhood is actually having problems. They're considered to be oppressed. So we're actually looking into the possibilities that our patient in the community will not be able to afford buying food in local restaurant or even restaurants. Then we also have to eliminate letter C. Nurse A conducts a survey on dietary habits in barangay. So when we are conducting a survey, it means that it does not actually correlate directly with the patient's hypertension, because we know that hypertension has a lot of costs. Because when I talk about dietary habits, that is going to focus on uh, lifestyle behavior of the patient. And just remember, in the board examination or any form of examination, if there are two choices that has the same impact or meaning, both of them are wrong. C and D talks about food, right? Dietary habits in the barangay and restaurants are focusing on food. Therefore, C and D are eliminated. Letter B: Nurse A starts a campaign that promotes gym membership. Remember, gym membership does not guarantee that the patient will have a decrease in the patient's blood pressure, but has to remember that there has to be an assessment that needs to be done in order for you to determine whether this patient indeed has hypertension, because you want to know the blood pressure of this patient for several screening activities. So therefore the best answer for number one is letter A. That is letter A for number one. So it's very important that there has to be regular blood pressure screening, because this can help identify individuals with hypertension and allowing for early intervention and management, which is crucial in reducing complications. So membering into a gym is actually a form of intervention already. And of course, you cannot actually afford going to the gym because your community is actually going to be considered depressed, right? So answer for number one, letter A. Number two: Nurse A noticed that people in the community lacks health literacy, and he wants to improve their health literacy rates while he is still the public health nurse assigned in the community. Which of the following strategy is most likely to become effective? A. Nurse A distributes complex medical journals to households. B. Nurse A hosts weekly educational workshops on chronic disease management. Letter C. Nurse A sends out monthly newsletter with health tips. Or letter D. Nurse A encourages the community members to watch health documentaries. Remember, as what I mentioned a while ago, if there are two uh, options that has the same meaning, we will eliminate that one immediately. Letter A and C has the same purpose. No, when you say nurse A distributes complex medical journals, so that is basically a paper. Then nurse A sends out monthly newsletter with health tips. That newsletter might actually be a journal. And what makes letter A wrong also is because of the word complex. When I say complex, the people in the community might not have the ability to understand. And remember, they have problems with health literacy. And letter D is actually going to be wrong because that is just watching a documentary. What we really need to uh, have for this patient is for them to be involved, for them to be engaged in a specific activity, because we know that if there will be a change in their psychomotor domain of learning, there is learning. So answer for number two is letter B. Nurse A hosts weekly educational workshops on health disease management. Because of course we know that interactive workshop engage participants in learning and provides opportunities to ask questions, making it a more effective approach to improving health literacy. Of course, I mentioned already a while ago that the focus of your workshop is that will improve the psychomotor domain of learning among your community residents. Number two is letter B. Let's now have number three. Nurse A conducted a random free blood sugar testing community residents in Barangay A. He noticed that several residents have high blood sugar with history of diabetes in their family. Nurse A is now designing a diabetes prevention program to Barangay B. Which of the following components should be given emphasis as a priority to maximize program success? So we're looking into the possible program success later on because we want to evaluate if the program has been successful. A. Free distribution of glucometers without follow-up. B. Mandatory weekly fasting for all program participants. C. Lifestyle coaching sessions focusing on diet and exercise. Or D. Online seminars accessible only to younger adults. Remember, in answering the examination, just take into consideration that there are considered to be this what you call uh, red flags or absolute terms that is actually being used in any examination. So example is for letter B, the word all, because that's actually going to be conclusive. No, so mandatory weekly fasting for all program participants. What if I will not actually submit myself for fasting or for FPS? No, so in that case, that will violate the patient's right for autonomy. The letter D also is the word only. No, online seminars accessible only to younger adults. Remember, we're talking about here individuals in the community. Therefore, we're expecting that these people are already elderly or getting older. So, and another thing is we are in the community setup. Therefore, we cannot actually expect that they have access to computer or cell phone. So, therefore, answer for number three is letter C. Lifestyle coaching sessions focusing on diet and exercise, because these lifestyle changes can actually be a pivotal experience in or pivotal method in order to prevent diabetes. And of course, we know that coaching can actually provide possible guidance and motivation of this specific client in the community that makes this program a successful program. So, answer for number three, letter C. Okay, so I've mentioned already the ratio. So, that is letter C for number three. Number four, Nurse A conducted a monthly, a community and conducted a community. What's community? Okay. I think there is gonna be a continuation for number four. That's community program. Nurse A conducted a community program, and during the meeting, the residents in the barangay A expresses concerns about the lack of mental health services in the barangay. What should Nurse A do first to address their concern about mental health services? A. Nurse A organizes a mental health awareness march. Letter B. Nurse A develops a referral system to existing mental health providers. Letter C. Nurse A sets up a community hotline for mental health crisis. Or letter D. Nurse A conducts a comprehensive community needs assessment for mental health services. Remember, as what I mentioned a while ago, that if you're gonna be talking about priority, or first, therefore it means that we're looking into the nursing process. So when we talk about the nursing process, the best thing that we need to do is for us to conduct an assessment. No, so therefore, letter A, Nurse A organizes a mental health awareness march. So you are actually talking about crafting a movement for that mental health awareness, but you have not yet assessed, you have not yet evaluated if there is really something wrong about the mental aspect of our patient in the community. In letter B, a nurse develops a referral system to existing mental health providers. This is going to be effective if you have already an idea that the community indeed has this higher rate of mental disorder. So therefore, letter B is wrong. Then also letter C is actually going to be wrong because nurse A sets up a community hotline for mental health crisis, because as what I mentioned, this is already an intervention. We focus on something that we need to do in order for us to foster a program, and that is through an assessment. So therefore, the best answer for number 4 is letter D. It's very important that we'll have this basic comprehensive assessment, because this will actually guide us and will actually allow us to have specific interventions that we are going to do in order to address this concern. At the same time, it will also be an important avenue for us to have a proper allocation of resources that could possibly be associated with the availability of resources in the community. Number 4, answer is letter D. Okay, so I've mentioned already the rationalization or the explanation, so that is letter D. Number 5, Nurse A is aware that part of his role as public health nurse in the community is to include schools within Barangay A in his program in the delivery of basic services in the community. Nurse A plans to collaborate with School A to improve the current nutritional status of their pupils. What specific initiative is most appropriate for Nurse A to start? So we're looking into initiative A. Nurse A bans all sugary snacks in school canteens. Letter B. Nurse A conducts for shorter lunch breaks to decrease meal consumption. Letter C. Nurse A focuses on providing meal with every meal. Or letter D, nurse A implements school garden project to grow vegetable. Of course, as what I mentioned a while ago, if there are absolute terms that is used in the choices, that's basically wrong. Letter A is wrong because of the word all. All sugary snacks in the school will actually be banned. So you cannot do that. You are actually not the higher authority. Okay? It should be the decision coming from a higher authority of the education department. Then letter B also, a campaign for a shorter lunch break, 15 minutes lunch break. No, so that's basically a form of a very authoritative decision making. Then letter C, nurse A focuses on providing meal. So wow, you're actually a bit rich. So in that case, that will actually consume much of your financial resources. So the best answer for number 5 is letter D. This is just simple because nowadays there's already a school garden that has been provided and mandated by the Department of Health in order to provide this pupil this fresh produce or fresh products that could actually serve as their meal during their nutrition celebration or during their activity in school, and that will actually promote healthy eating and, of course, healthy nutrition among the pupils. Number 5 answer is letter D. And the Russia is school gardens can provide fresh produce for meals and serve as educational tools for children to learn about nutrition and healthy eating. Number 5, letter D. Number 6, Nurse A considers establishing strong partnerships and networks to enhance healthcare access among people in the community. Which are the following potential partner should he prioritize? Again, it's prioritization. A. Local bakeries to discuss reducing sugar in their products. Letter B. Corporations to secure funding for high tech medical equipment. Or letter C. Nearby hospitals to facilitate outreach clinics. Or letter D. Local gyms to offer early morning exercise classes. Remember, the question here is partnerships, no? Enhance healthcare access. Healthcare access. The question is healthcare. So when we talk about local bakeries, it will not address healthcare. It will not increase our access to healthcare. And at the same time, local gyms will not actually going to increase our access to healthcare. But the most important here is basically on our primary facilities, and that's gonna be our barangay health station. Therefore, the best answer for number 6 is letter C. nearby hospitals to facilitate outreach clinics. So that nearby hospital can actually be an avenue for the community to invest time, especially on access of healthcare services among uh, the community residents. And usually, this partnership will actually going to develop or improve our access to medical services, especially for those community residents who may have problems, especially with their transportation. And at the same time, if there is going to be the risk of financial barriers because they don't have money to go to the nearest hospital. Answer for number six, letter C. Seven. Let's now have situation B, or next situation. Nurse B, a community health nurse, is working in culturally diverse community with a very limited access to healthcare services when she accepted the job at the Department of Health's Human Resource for Health Nurse Employment Program. The community struggles with higher rates of chronic illness, inadequate preventive care, and low health literacy rates. Nurse B is tasked by the DOH with developing and implementing strategies to improve health outcomes and access to services in Barangay B. The following question applies to this question or situation. Number seven. Nurse B is assessing emergency preparedness in Barangay B. What is a key area that Nurse B should focus on? So the question is about emergency preparedness. A. Nurse B distributes emergency preparedness brochure. Letter B. Nurse B trains community volunteers in first aid and emergency response. Letter C. Nurse B builds a new emergency response center. Or letter D. Nurse B creates disaster-themed entertainment events to raise awareness. Remember, as what I mentioned earlier, the focus for learning is basically on shifting or changing their mindset or their psychomotor domains of learning. And of course, as what I mentioned later, if you're going to be talking about brochures or papers, it means that it will actually be a bit of just purely knowledge, but there will be no shift of uh, emergency preparedness or competency development. So letter A is eliminated. Then letter D, Nurse B creates disaster-themed entertainment events to raise awareness, just raising an awareness, but you are actually not making them be capable of and developing their competency. And of course, you are actually a bit rich because you're going to be making now an emergency response center. No, so in that case, we have to remember that we are facilitators. We are not the one making our project be implemented in the community. So best answer for number seven is letter B. Because when you train volunteers, it means that you're going to be giving them the opportunity to be empowered. At the same time, it will also going to improve their skills and their competency in order to possibly respond to circumstances, emergencies. And at the same time, that will actually going to enhance their preparedness if there is actually emergency, and at the same time promote resilience in the people. Seven is letter B. Okay. Number eight. Nurse B notices that many elderly community members do not attend regular health checkups. What barrier should Nurse B address first? A. Transportation issues. B. Lack of health education. C. Complexity of medical treatments. Or letter D. Long wait time at clinics. Remember, elderly, and we are on a community setup. And remember, the most common aspects that, as I think I've mentioned that one a while ago, we're talking about money. No, we're talking about money, and at the same time transportation. No, lack of health education, they will actually be taught on things in the clinic or in the barangay health station. And the complexity of medical treatments, we are in the community setup, therefore we're taking into consideration our primary facilities, and we cannot expect these medical treatments to be complex, because if that's going to be complex, it means that you're going to go towards tertiary facility. Then long wait time at clinics. Of course, if that's gonna be in health center, there might actually be time for you to wait. But of course, the most significant thing that we're going to look into is we have to address this transportation issue, because that's most of the barrier of their checkup. And at the same time, financial matters also. And if that's gonna be addressed, then it will actually increase the attendance at health checkup or regular checkup. So number eight answer is letter A. Nine. Nurse B considers several strategies in order to improve vaccination rates in Barangay B. Which one would likely have the most immediate impact to community or to the community? Letter A, Nurse B produces a documentary about vaccine development. Letter B, Nurse B creates a pop-up vaccination clinic during community events. Or letter C, Nurse B then distributes information flyers through mail. Or letter D, Nurse B posts motivational vaccine success stories on social media. Take note, if you're gonna be, as what I mentioned, if there are two choices that has the same meaning, both of them are wrong. Letter A is about documentary, right? And of course, the third D is about video also, because you're talking about success stories. A and D, eliminate. Answer for number 9 is letter B. As what I mentioned, if that's going to be focused on informative liars, that is only purely knowledge. No? So what you're going to be doing is, in order for them to uh, to participate with vaccination, you have to take into consideration having these specific clinics or this pop-up vaccination clinic, especially if there are mission activities, because this will actually possibly increase their access. At the same time, it is a bit convenient to them, and because that is convenient, that will actually promote higher vaccination rates, and that is through a direct engagement in the community, and that is actually on a direct their delivery of service to the community. So that is letter B. Number 9, letter B. Number 10. Nurse B collaborates with local leaders in Barangay B to manage chronic diseases more effectively and efficiently. What approach should Nurse B take to engage them successfully in the plan? A. Nurse B holds a formal meeting at the nearest hospital boardroom. Letter B. Nurse B conducts a series of anonymous surveys. Letter C. A nurse B. Hosts an informal meeting at a local community leader's home. Or letter D. Nurse B. Distributes a written report on a community health issue. Just remember, there is a need for us to engage them. No, so of course, when you talk about boardroom, we cannot actually easily access. Of course, Barangay B probably does not have any hospital at all. No, and then of course, when you are conducting surveys, it should be it should be a single survey only. It should not be series, because that's already a form of an evaluation whether the community is receptive to the care that you're going to be providing. Then letter D, again, that is basically reporting, no? So the most important thing is you have to engage them and let them be part of the decision making. So that is considered to be an informal setting, ang community, community leaders home, or just the waiting shed, that is going to foster possible trust and at the same time an open dialogue, because that will actually going to enhance and encourage our local leaders to share their insights, and at the same time to actively participate in these health initiatives in order to meet the needs of the community. So number 10 is letter C. Number 10, letter C. 11. Nurse B wants to ensure community continuous improvement in the delivery of healthcare to Barangay B. How can Nurse B achieve this effectively and efficiently? A. Nurse B establishes a suggestion box at the community center. B. Nurse B provides annual health fairs with no follow-up. Letter C. Nurse B rotates nursing staff frequently to maintain interest. Or letter D. Nurse B conducts a quarterly evaluation of community health programs. Of course, if you're talking about improvement, so in community health nursing, there has to be reporting of your out of your survey every month. There is a monthly, there is quarterly, and there is an annual submission of reports. It's because that is one way of an evaluation whether there's a need for you to improve your services that has been provided. So letter A is actually going to be wrong, because having a suggestion box in the community does not guarantee that there's going to be improvement. And it's good that you're going to have health fairs or medical mission, but there has to be some follow up. No, letter B is also eliminated. And then letter B, letter C, Nurse B rotates staff frequently to maintain interest. We are talking about public health nursing here. We're not talking about staff. And remember, when we talk about rotation, it might actually going to create confusion. to our recipients of care. That's why it's very important that there has to be establishment of trust from the nurses that has been exposed to the area. So answer for number 11, letter D. That is letter D. 12. A sudden increase in respiratory illness in Barangay B prompt Nurse B to act. What is Nurse B's best course of action? A. Nurse B investigates potential environmental factors causing the issue. Letter B. Nurse B distributes respiratory masks to all community members. Letter C. Nurse B implements a smoking ban throughout the community. Or letter D. Nurse B launches a campaign on the use of air purifiers. Of course, as what I mentioned earlier, letter B is, as what I mentioned earlier, if there is an absolute term that is used that is absolutely wrong, letter B is wrong, no? Because that is mass to all community members. And of course, letter D is also wrong because you cannot afford all to for you to give a purifier. So because of the sudden increase in the respiratory illness, it's your important thing to do is the assessment, no? Because it does not only talk about smoking as the main cause of uh, the problem, but it could possibly be another form, no? So the best answer here is letter A. Nurse B investigates potential environmental factors causing the issue. So in that case, that is going to evaluate whether this patient is, the community has this problem of the increase in your uh, respiratory illness. So number 12 is letter A. Let's now have another topic, which is about control of non-communicable diseases. So that is questions 25 to 37. Situation. Nurse C is a community health nurse who is working in a rural community under the nurse deployment program of the Department of Health. He is preparing a comprehensive plan in the control of non-communicable diseases that is currently prevalent in his assigned community. The following questions apply to this situation. Number 25. Nurse is planning to act in reducing the increasing incidence of type 2 diabetes in his assigned community. Which are the following initial steps should Nurse C take to address the issue effectively? Initial step. A. Nurse C will distribute free glucometers to residents. Letter C. Letter B. Nurse C will conduct needs assessment to understand community behaviors and resources. Letter C. Nurse C will implement a community-wide diabetes screening event. Or letter D. Nurse C will start a support group for people with current diabetes. Remember, initial or priority. You cannot just act immediately without proper assessment. So therefore, the best answer for number 25, B. You need to assess first. And then after the assessment, what you'll be doing is probably you're going to create an activity that might actually going to help you in addressing the concern. So therefore, letter D might actually be after letter B. And at the same time, letter C is also going to be after letter B. But you need to do first is conduct an assessment before you are going to make an intervention. And of course, if you're going to be distributing glucometer, that is going to cost you a lot. So letter B is the best answer. You need to assess first because this will allow us nurse to gather appropriate information that could possibly be specific to the community regarding the factors that affects the increase in the diabetes incidence. At the same time, that could also be an avenue for you to craft your own intervention later on. So answer for 25, bravo. 26. Nurse C is expanding his roles and responsibilities in the nearby community local school, and he focused on developing a program to reduce childhood obesity which targets school-age pupils. Which of the following is an essential component for Nurse C to focus for long-term success of the said program? A. Nurse C provides gym membership to children in school. Nurse C organizes monthly lectures on nutrition. Letter C. Nurse integrates physical activity into the daily school curriculum. Or letter D, Nurse distributes flyers on healthy eating habits. Remember, as what I mentioned earlier, if that's going to be about flyers, that will not be something that will enhance their learning capacity. So letter D, eliminate. Then again, children enrolled in a gym that is, and of course we are focusing on the community, therefore we cannot expect that there's a gym in the community. And then monthly lectures on nutrition is actually not engaging, but what is more engaging is for us to include a physical activity every day in order for us to reduce the risk of obesity. 26, letter C. That's letter C. Okay. 27. While Nurse C is conducting a home visit, he discovers that the family has many members who smoke. Which of the following interventions would be most appropriate for Nurse C to initiate in the community level about the situation? A. Nurse C sets up a hotline for smoking related queries. Nurse C offers nicotine patches to family members. Letter C. Nurse C provides one on one counseling sessions at the health center. Or letter D, Nurse organizes community workshops on smoking cessation techniques. Of course, when we talk about this one, it is very important that we're gonna be remember you how you have conducted a home visit, right? And remember, the home visit will not actually going to end there. There has to be a follow-up. And usually the follow-up will happen in the health center or clinics because there is this what you call clinic visit. Because we want to determine if this concerned individual will share more if that's going to be not in the vicinity of their houses. Therefore, the best answer here is letter D. Organizes community workshops on smoking cessation techniques because that is more engaging, and counseling sessions is not engaging because sometimes this patient will be reserved. No, they will not share to us what they really have experienced. So this workshop is actually an opportunity to provide education and at the same time support to these individuals who are actually smoking, and at the same time this is not stereotyping them, and it will enhance broader community participation and in order for us to reduce our smoking uh, incident. Then hotline that will be specific for a bigger municipality and city. And then nicotine patches to family members that is not actually reducing smoking, but still you are offering this carcinogenic uh, substance to the family. 27, letter D. 28. Nursi attended a community assembly organized by the Barangay Council of Barangay C, and he was asked to deliver a talk to discuss the rising cases of hypertension in the community. Which of the following should Nursi assume as the most significant role he must meet during this meeting? A. Nurse advocates for mandatory medication for all diagnosed individuals. Letter B. Nurse criticizes the community for their unhealthy lifestyle choices. Letter C. Nurse provides culinary classes focusing on exotic cuisines. Or letter D. Nurse presents data on local hypertension rates and suggests preventive actions. Of course, I have mentioned already this one a while ago that if there are absolute terms, that's wrong. So letter A is wrong. All diagnosed individuals, you cannot afford that. Then of course letter B is also wrong. Remember another strategy in answering is if there are the polarities of choices. What we're looking for here is positive option. So letter D is basically negative because you are criticizing. Then letter C is also going to be not uh, feasible because you're not a chef. Most of us nurses doesn't know how to cook, and you're talking about exotic cuisines here, so that might actually induce hypertension. Then, so answer here is letter D. Presents data on local hypertension rates and suggests preventive actions. Remember, if you're going to be presenting rates of hypertension, that is utilizing evidence-based information, and that is a form of a practical suggestion that we can have in order for us to let these people believe that indeed there is hypertension in the community. 28, letter D. 29. NERC has included targeting cardiovascular disease in his assigned community. Which of the following priority focus should NERC take as a nurse-led initiative? A. NERC screens adults for congenital heart defects. Letter B. NERC implements regular community-run marathons. Letter C. NERC educates the community about managing stress and anxiety. Or letter D. NERC offers free cholesterol lowering medications to low-income residents. So number 29, of course, if you're talking about cardiovascular disease, and we're talking about here engage priority, so screen adults for congenital heart defects. So in that case, this is adult already. When you talk about congenital, it means it has been known ahead of time during their younger years. Letter B, nurse implements regular community-run marathons. Remember, if there is cardiovascular disease, it might actually induce this patient to have complications of the condition. Then letter C, educate the community about managing stress and anxiety. That is not the only focus of the development of this cardiovascular disease. It is multifactorial. So answer here is Nurse offers free cholesterol lowering medications to low income residents. That is offering, but not giving it to all. So 29, the best answer is letter C, because that is already that already helps in reducing the possible risk factors that could possibly be associated with the development of cardiovascular diseases, and that can also be applied across the entire community. So 29, letter C. 30. Nursey notices that there are increasing cases of chronic respiratory conditions in the nearby industrial area of the community. Which of the following actions is most appropriate for Nursey to take? A. Nursey moves residents away from the area. Nursey encouraged local government to enforce stricter air quality house regulations. Letter C, Nursey provides air purifiers to every household. Letter D, Nursey conducts individual lung health assessments. So here, since we are talking about industries, of course, we know that there are communities that has already these industries already know. And then when we talk about air purifiers, that every household that is going to cost a lot of money. And then since we're talking about industrial area, industry or the community itself, then there's a greater possibility that it they will actually going to follow, especially if the local government will actually going to get involved. So the best answer for 30 is letter B. No, letter C is talking about assessment, but even if you're gonna be assessing them, it will not take any effect at all. It's because the industry is still there within the perimeter of the community. So you cannot move them. You will be building your own society. No? So letter A is also wrong. So best answer for number 30 is letter B, because that will usually be an avenue for you to improve your air quality, and at the same time that might be sustainable in order for us to have this specific measure. 30, letter B. 31. Which of the following is the most effective way for a nurse to reduce salt consumption in the community who is prone to hypertension? A. Nurse C advocates for policies requiring reduced salt content in processed foods. Letter B. Nurse C distributes pamphlets with salt-free recipes. Letter C. Nurse bans the sale of salty snacks in local stores. Letter D. Nurse C arranges a cooking competition focusing on low-salt meals. Of course, wrong na daan ang letter B, pamphlets, no? Because in that case, my God, this is not going to be engaging. And banning is the responsibility of the local government unit. And competition, that's not actually going to help us. But as much as possible, there has to be policy in the local government unit that is on the production of the food. And at the same time, that will have a wide-reaching impact to the community, and this might they end up reducing their salt intake. Thus, it will also help in reducing the risk of hypertension in the community. So 31 is letter A. 32. So situation, Nurse D, the public health nurse of Barangay D, is assigned to craft programs and strategies about cancer control in his assigned community. He is aware that in Barangay D, an increasing case of cancer, which is possibly attributed to lifestyle practices. The following questions apply to this situation. 32. As a community health nurse, which of the following should Nurse D focus as primary aim of the cancer prevention program for a community with increasing smoking rates? A. Nurse D creates a campaign highlighting the benefits of smoking. B. Nurse D distributes free cancer screening voucher. Letter C. Nurse D provides medication to aid in smoking cessation. Or letter D. Nurse C sets up a support group for cancer patients. Remember, you are preventing the cancer. So letter D is wrong because there is already cancer. You cannot prevent that anymore. No? Then, of course, letter C is also wrong because you are providing medications for what? What medication is that for? And of course, letter B is also wrong because it's talking about paper, so it will not be engaging. Answer Alpha. Nurse D creates a campaign highlighting the benefits of quitting smoking because that might actually be engaging to them, and that will educate the community about the benefits of quitting the smoking practice, and that will reduce one of the primary risk of cancer, which is actually on smoking. That might actually be an effective way of preventing cancer. 32, Alpha. 33, Nurse D aims to increase cancer screening rates in Barangay D with limited healthcare access. Which of the following strategies would be most effective? Nurse D offers transportation services to urban cancer centers. Letter B, Nurse D establishes regular mobile clinics for cancer screenings. Or letter C, Nurse D distributes educational flyers about cancer screening importance. Or letter D, Nurse D provides financial incentives for attending screening. So in here, we're talking about effective access to healthcare. So in that case, I think the most significant there is bring the service to the recipient. We're not going to be transporting them, but rather bring them, or the services is brought to the community. And the third is wrong because you're promoting dependence. That's financial incentives. And as what I mentioned about flyers here about screening is not engaging to the patient, but what is engaging here is for us to bring the clinic to the community. 33, bravo. 34. Nurse D is currently conducting a barangay workshop about dietary factors in cancer prevention. Which of the following dietary modifications should Nurse D emphasize? A. Increasing intake of red and processed meats. B. Following a high sugar diet. C. Consuming more fruits and vegetables. D. Drinking more sugary beverages. Of course, B and D, same ang thought niya. No, kasi nga sugary, sugary. So letter B and D eliminate. Then letter A, that is highly cancerous. Answer C, consuming more fruits and vegetables, because this will actually reduce risk of cancer. At the same time, making this a very significant focus on dietary modification that prevents cancer development. 34, Charlie. 35. Which preventive measures should Nurse D promote to address the high prevalence or incidence of skin cancer among residents in the sunny coastal community of Barangay D? Nurse D encouraged residents to sunbathe early in the morning. B. Nurse D advocates for regular skin examination. C. Nurse D teaches residents to avoid outdoor activities. Or D. Nurse D distributes free sunscreen at community events. Of course, the focus of this one is uh, address the high incidence of skin cancer who are actually in a coastal community. So that's already in a coastal community. So when you say sunbathe early in the morning, it means that it might actually have an impact to them also. And regular skin self-examination that might actually cost a lot for the community. And the most significant here is for us to provide an opportunity for them to get rid of the uh, UV rays. Therefore, we're going to be providing sunscreen to the patient that will actually going to help them reducing the risk of skin cancer. So 35, Delta. Last two numbers, which of the following interventions should Nurse D focus and prioritize with the goal of reducing breast cancer mortality in Barangay D? Nurse D conducts monthly breast cancer awareness seminars. Nurse D offers genetic testing for all women in the community. Nurse D publishes success stories of breast cancer survivors. Or Nurse D organizes routine mammogram screenings and follow-up. Of course, mali na kagad ang letter B because all women, that is absolute. Then, conducts monthly breast cancer awareness seminars, that is seminar. There has to be something that needs to be done in order for you to evaluate the risk of cancer development. Then the third C, flyers. Nasad ni siya, success stories, that's video, so that will be not engaging. Answer D, because that is using a mammogram that could possibly reduce breast cancer mortality by having this activity more often in order for us to treat the condition at an earlier stage. So number 36, letter D. 37. Which of the following roles should Nurse D perform in minimizing the environmental risk factors for cancer within a highly industrial community? Nurse D advocates for stricter environmental pollution controls. Nurse D develops a preparedness plan for potential cancer outbreak. Nurse D provides mouth rinses to prevent skin contamination. Or Nurse D teaches communities how to adapt to living with pollution. Of course, if there's gonna be an urbanized community, it is our responsibility then to make sure that there has to be regulatory factors or regulatory laws that might actually be beneficial for the patient. So number 37 answer is letter A, because that will actually gonna be one way of reducing exposure to possible carcinogens, and thus it will actually lower the risk of cancer to the community. 37, letter A. So that is it. Thank you so much for your time. Congratulations, everybody. See you again in our next exam.